If you've been told that your weight might be contributing to your difficulty getting pregnant, but no one's ever told you why, then this is the video for you. I'm going to go through the top reasons and facts of why excess weight and obesity can affect fertility. So, number one, the excess body weight and excess fat can affect how your fat tissue communicates with your brain. So we call this the HPO axis, and it's for the hypothalamic pituitary ovarian axis. And it's basically the normal signaling process that has to happen between the brain and the ovaries to make an egg each month. And when you have excess body fat, that can disrupt that hormonal system, and it can increase your chances of having anovulation or not releasing an egg every month. Number two, hyperinsulinemia or high insulin levels. So what excess weight does is it causes increased insulin resistance so that your body does not respond to the insulin like it should. So your pancreas, which is where your insulin is secreted, has to work even harder, and it secretes more insulin to try to help your body work the way it's supposed to. Those high levels of insulin can affect lots of different organs in your body, but one of them is your ovaries. So high levels of insulin cause your ovaries to secrete higher levels of male hormones or androgens, and those can also cause ovarian dysfunction, can cause you not to ovulate, and it can cause the ovaries not to work very well. Number three, chronic inflammation. So the fat tissues that are in the body, they are secreting different molecules and hormones, and these molecules can cause chronic inflammation. And when you have inflammation in the body, that's good on a short-term basis, but on a long-term basis, a chronic state of inflammation causes effects again on the ovaries. It can affect implantation. It affects all the different reproductive systems that need to be aligned and in balance to help you conceive. Number four is an increase in oxidative stress or lipotoxicity. And that's just a fancy word that means that the fat cells in your body, especially the fat that's around the abdomen, we call that visceral fat, can secrete toxic molecules. They're called adipokines that can affect the way that, again, the ovaries are working, the way embryos implant. And so this kind of lipotoxicity is another reason why having excess body fat can affect your fertility. Number five is affecting endometrial implantation. So there's something called endometrial receptivity, and that is when your uterus is receptive to an embryo. And that can be altered or changed with increased body fat. And so when the embryo goes into the uterus, it doesn't send the right signals, or those signals are disrupted. And so the implantation of that embryo can be affected. Number six, so having obesity can also make other metabolic disorders worse. The first one that comes to mind is PCOS. So PCOS, or polycystic ovarian syndrome, and obesity have a lot of overlap with the disruption that they have between the brain and the ovaries and the insulin levels. And so as weight increases, those PCOS factors also seem to get worse. Number seven, I think we're at seven, having an increased body weight can decrease your fertility because it can decrease the success of our different fertility treatments. So things like in vitro fertilization, we know that as BMI increases, the chance of pregnancy goes down. So it can affect natural pregnancy, but also when we do fertility treatments to try to overcome those different fertility factors, when your weight is increased, the treatments are less successful. And lastly, having an elevated body weight can affect miscarriage rates. So we know as body weight increases, miscarriage rates increase as well. So those inflammatory factors, those endometrial factors can affect embryo development and also implantation stability. So that's just an overview of the reasons why your weight can affect your fertility, all the way from the hormones that come from the brain all the way into implantation and miscarriage.